the bigger picture of prevention, of preparedness, if you will, now, from the department's point of view, Barry Roper, what can you tell us that what the department is doing, what the government is doing, what the authorities are doing?
Okay, from the Department of Health point of view, since we diagnosed, confirmed the dengue in Daru, what we have done is we've sent out a circular information to all health, health workers in the country, to all the provincial health authorities, telling them about dengue, presence in the country, and also so that the health workers can know the signs and symptoms and how to diagnose and differentiate between malaria and dengue. And quite recently, we've also sent out similar circular information, including now Zika virus.
Okay.
So that they can also look out for surveillance purposes, so that they can collect the samples for us, so that we can do the test and confirm whether we have Zika virus here or not. With that same information, what we have also given them advice on to how to go about community awareness. To take the responsibility at the province level, at the district level, wherever they are, and work along with the cities and authorities and how to advise the people. So we've actually given that information so that the province need to act on it.
Okay.
That is our response, to provide that information. We've done that.
Right.
Now that the Zika virus has been confirmed, today the secretary has already declared. That's why we are here to declare that we have confirmed Zika virus now on behalf of the secretary from Department of Health. We declare that the Zika virus here.
Given the world attention, Barry, it's almost frightening to hear that you say that.
Yeah, but that, like my colleague said, I think we not need to be, really frightened about it, because we have similar virus, like we've had chikungunya, we have dengue, but as my colleague said, it's a mild disease. Sure. What we need to do is I think the prevention side is important.
But we can't be complacent about it, can we? I mean, government, the individuals, we need to do something about this.
So the important thing now is, I think, for the local health authorities from the provincial level and local level to take our advice. We've given the advice information to the provinces. And
when did that advice go out? As soon as you confirmed it?
As soon as we confirm, we give. For dengue, it's already out.
Sure.
Okay. For Zika virus, also we have sent out already.
We sent it before because we knew that Zika was happening on the world stage, and that we wanted the local health authorities to be able to identify it and report to us, in case there was an outbreak of Zika or something like that. Yeah. But in fact, we've found, as I said, it's been here all along. There actually isn't an outbreak of Zika. There are outbreaks of dengue.
Yeah.
Yes. And we've had Zika. Yeah. Okay. What about capacity here in the national capital, perhaps in Daru, Kiunga, and in the provinces, to deal with dengue and Zika? Do we have the capacity out there?
I think in terms of capacity, in terms of case management, there's no treatment for dengue or either Zika virus. I think the advice would be for patients to have more water and rest one day, and there's no medicines involved.
Yeah, there's no specific treatment that's a magic bullet like there is for malaria.
They could get Panadol or things like that to relieve the pain.
Okay.
So that's easily to manage, but the important thing is for us to know whether we do have Zika virus and to test it.
Yes.
Now this declaration is made on all samples. Now the surveillance is ongoing, and the samples will be still coming, and we will do the test to confirm how spread the Zika virus is.
Okay, the Zika thing in particular. Now that it's announced that we've had it, it is out now. It has a lot of implications. There is that economic implication. There is that political implication. There's all sorts of implications now because of the world attention to Zika. Yeah. Is our government or the health department, sure, but from a government level, has that been communicated to government to do things about that?
Well, the declaration is taken now. We have declared Zika now, so as I said, we will address the Zika virus as similar as dengue, like other vector-borne diseases like malaria, because the approach for malaria, to kill the adult mosquitoes and to keep the environment clean and to destroy water collection is still the same approach. And I think this can be done by the people themselves, by the communities. Okay. It's really not for the health department to go and start cleaning the backyard, but as we declare now, people should not get ownership of their own health, and the health authorities in the province and local level governments should be able to work with the respective city authorities and local governments to work with the communities to take the preventive measures.
Yep, okay. Barry, Doctor, we are running out of time. Just one final question. We've had mosquitoes here in this country. We're a tropical nation. We have mosquitoes. And together with it, unfortunately, we've had malaria for many, many years. Can malaria, like in other countries, can it be eradicated? Can mosquitoes and malaria, can we ever eradicate malaria and mosquitoes, if you will? I mean, you guys are the medical experts. I don't know.
It is possible to eliminate malaria in a country, and in fact, various countries in the past have done that. It does take a lot of work, but once it's eliminated, then malaria is caused by a parasite that lives in the mosquitoes. It's not just any mosquito that has it, and if you can keep enough people treated and avoid getting enough people from getting bitten, then eventually you can get rid of the parasite itself. Okay. I think it's a much taller order to try to get rid of all the mosquitoes. We would certainly love that, but
malaria is one of the big killers of this country. It has been for many years.
It remains a big killer. It does. It certainly does. And there are certainly a lot of efforts going on in our colleagues from the malaria programs that are addressing that and hope to eliminate malaria in PNG someday. It's only in a few Pacific countries, PNG, Solomon Islands, Vanuatu. It used to be in others, and it's being eliminated. The mosquitoes, I think, are here with us to stay, unfortunately.
Dr. Palvin, pleased to talk to you, and my good friend Barry Roper from the Health Department. Good to talk to you. Thank you.
Thank you.
Dr. Boris Palvin of the World Health Organization and Barry Roper of the Survey and Emergency Response Unit of the Health Department. After the break, the fight to protect Bilum designs from being commercialized by foreigners.